Why are advanced chondrosarcoma treatments so limited? Imagine facing a tumor that just won't respond to the usual treatments like chemotherapy or radiation. That's the reality with advanced chondrosarcoma, a type of bone cancer that is notoriously resistant to many standard therapies. This resistance is rooted in the unique biology of these tumors. Most chondrosarcomas, which make up about 90% of cases, grow slowly and have a low rate of cell division. Because of this, they don't respond well to treatments that target rapidly dividing cells, like chemotherapy. Plus, these tumors overproduce a protein called P-glycoprotein, which acts like a pump, pushing chemotherapy drugs out of the cancer cells before they can do any damage. The dense cartilage matrix surrounding the tumor also plays a big role. Made mainly of collagen-type Roman II and hyaluronic acid, this thick barrier makes it hard for drugs and immune cells to reach the cancer cells. Adding to the challenge, the blood supply to these tumors is limited, creating a hypoxic environment where oxygen levels are low. Radiation therapy relies on oxygen to damage DNA effectively, so low oxygen levels make radiation less effective too. Because of these factors, chemotherapy and radiation often only help with symptom relief or slow down tumor growth, but they rarely cure advanced cases. The tumor microenvironment adds another layer of complexity. It involves interactions between tumor cells, surrounding stromal and immune cells, and the extracellular matrix. These interactions can protect the tumor and make it harder for drugs to work. Currently, there are no approved targeted therapies specifically for conventional chondrosarcoma. Researchers are exploring options like IDH1 inhibitors, EZH2 inhibitors, and immunotherapies, but these are still in experimental stages and not yet available for routine treatment. Since chondrosarcoma is a rare disease, it's difficult to gather enough patients for large clinical trials, which slows down the development of new treatments. Often, diagnosis is delayed because symptoms are vague, allowing the tumor to grow larger and become more difficult to treat. Surgery remains the main approach for localized tumors, aiming to remove the cancer completely with wide margins. For advanced or metastatic cases where surgery isn't possible, options are limited mostly to palliative care or experimental therapies. In summary, the limited treatment options for advanced chondrosarcoma are mainly due to its biological resistance to chemotherapy and radiation, the protective cartilage environment, the rarity of the disease, and the lack of approved targeted drugs. Ongoing research into molecular pathways and new therapies offers hope, but it will take time before these advances become widely available. If you or someone you know is dealing with this diagnosis, it's essential to work closely with healthcare professionals who can tailor the best possible approach based on the latest scientific evidence.